My name is Dr. Tesfaye. I'm a consultant radiologist at Addis Ababa University. I'm currently an instructor and associate professor at the Department of Radiology. So the main challenges of access to ultrasound service in our country, like the developing country, is having the ultrasound machine itself. And even if you have the ultrasound machine, it is stationary. You cannot move it from one place to another place. Handheld ultrasound is different from the conventional ultrasound, which you can just take it with your pocket and go to the patient rather than patient is coming to you, particularly in remote settings where there are lots of institutions. Sometimes one of couple of institutions may have a handheld ultrasound and the operator can take the machine and go from one institution to another institution. So this, rather than having a stationary ultrasound, this improves access to the service. Vscan Air, as you can see, it's a very handy, compact design. It's wireless, it's easy to carry. Go to the bedside and go to the ICU to scan. And the other good thing about Vscan Air is it's a dual probe design. On one side, it's a linear probe. On the other side, it's a curvilinear probe. So you can use the probe for many applications like abdominal applications, obstetric applications, cardiac applications, vascular, musculoskeletal. Even you can use the probe for guided procedures and so on. Vscan Air is easy to use. You can just seamlessly connect your application either in your phone or your tablet. It doesn't have a cable, so you can easily go through the scanning. And the other most important thing is you don't have complex keys on the screen, and it is user-friendly. Vscan Air can be used at any stage of pregnancy. In the early pregnancy, the value of ultrasound is just confirming whether there is pregnancy or not. The number of pregnancies also can be picked by ultrasound in the early times of pregnancy. In the midterm and late pregnancy, you can see the viability by looking at the cardiac beat. You can see also the fetal anatomy for any malformation. You can also look for the placental location. And you can also check the adequacy of the amniotic fluid. And also, you can check the maternal anatomy, like the adnexus formosus, the Douglas pouch, for fluid. Without having ultrasound, it increases also the morbidity and mortality for both the fetus and the mother. According to the World Health Organization, then a pregnant mother at least should have one ultrasound scan throughout the pregnancy. If we don't have this ultrasound during antenatal care, so we don't know whether the pregnancy is within the uterus or outside the uterus, maybe ectopic and may rupture and patient may die. We don't know the viability of the fetus. By simply checking the cardiac activity, you can assure the viability. If we cannot do that, the mother may carry a dead fetus for a long time. The benefit to the patient is having access to the ultrasound service. The other thing is also it reduces cost, like cost of traveling. And so if you don't have like portable ultrasound, the patient should travel to you or to travel to other places. So the cost of travel and the cost of having a complex ultrasound machine for which like Vscan Air or handheld ultrasound may be sufficient to establish the diagnosis.